All right, today we're going to dive into two really serious medical emergencies, cardiogenic and anaphylactic shock. Now, they can look surprisingly similar at first glance, but giving the wrong treatment can be absolutely catastrophic. We're going to use some key insights from medical training materials to show you exactly how professionals tell them apart. Let's jump right in.
So, have you ever wondered what happens when the body's most critical systems just get pushed too far? Well, that moment of total system failure, when your vital organs just aren't getting the blood and oxygen they need to survive, that's what doctors call shock.
Okay, first up, we've got cardiogenic shock. And honestly, the easiest way to think about this one is that it's a pump problem. It's that simple. The heart, the body's main pump, is failing.
So, what does that really mean? It means the heart muscle has gotten so weak or damaged, you see this a lot with a major heart attack, that it just can't physically push enough blood out to the rest of the body. The engine of the whole system is basically sputtering and shutting down. Okay, here's a great little memory hack that pros use all the time, and it's super simple. When you see cardiogenic, I want you to think cardiac. The name itself is telling you exactly what's wrong. It's the heart. That one little trick points you right to the source of the problem. All right, so theory is one thing, but what does this actually look like when it's happening to a real person? Let's walk through a scenario. Imagine a client is having a heart attack, a myocardial infarction, and we're glued to their vital signs, watching what happens. Okay, now let's really look at this chart together. At 11 a.m., the blood pressure is 140/88. Still high, but okay. But then, just 15 minutes later, see that? It's dropped. Then, at 11:30, it drops again, pretty significantly. And by 11:45, wow, we're down to a critical 88/58. You can literally watch the crisis unfold right here in the numbers. And that right there, that downward spiral of the blood pressure, that is the absolute textbook classic sign of cardiogenic shock. As the heart muscle fails, it just can't generate enough power to keep the pressure up, and the whole system starts to collapse. So, the pump is failing. What do? Well, the goal is pretty simple, even if the situation is complex. You've got to help that heart do its job again. Let's see how the medical teams jump in to do just that. And the go-to tools for this job? Two key medications, dopamine and digoxin. Think of these as the cavalry coming in to give that struggling heart muscle the support it desperately needs to get the blood pressure back up.
Now, you might be wondering why these specific drugs. Well, it comes down to something called an inotropic property. I know it's a fancy medical term, but the idea is actually really simple. It just means these drugs have the ability to make the heart contract with more force. They give it more power to pump. And hey, here's another awesome little trick to remember what digoxin does. Just think of the D in digoxin as standing for a deeper contraction. It helps the heart get a really good, deep, powerful squeeze with every beat. It's all about improving the quality of the pump. But, with any powerful drug like this, there's always a catch, right? You're pushing the heart harder, so you have to be super careful. Medical teams watch like a hawk for things like the heart rate getting too fast, that's tachycardia, or the rhythm getting all out of whack, which is an arrhythmia. It's a real balancing act. All right, let's totally switch gears. I want you to put the heart problems aside for a second, because our next type of shock, anaphylactic, has absolutely nothing to do with a failing pump. This is the body's own immune system going completely haywire. Yeah, we're talking about that massive, overwhelming allergic reaction you hear about, maybe from a bee sting or someone with a severe peanut allergy. The body's defense system just goes into complete overdrive, and that kicks off a cascade of life-threatening problems. And you guessed it, we've got another memory hack for this one. Just like before, the name gives you the biggest clue. When you see anaphylactic, I want you to immediately think allergic reaction. It's that simple, and it keeps it totally separate from the cardiac problem in your mind. So if the problem is a full-blown allergic meltdown, you need a powerful fix, and you need it fast. The number one absolute priority life-saving treatment is epinephrine. You've probably heard of the device used to give it, the EpiPen. Okay, now for the main event. Let's put these two emergencies side by side, because when you see them contrasted like this, that's when it all really clicks into place. So look at this. On one side, cardiogenic shock. The cause? The heart pump is failing. The problem? No circulation. The treatment? Drugs like dopamine and digoxin to make the pump stronger. Now look at the other side, anaphylactic shock. The cause? A huge allergic reaction. The problem? All the blood vessels in the body suddenly open wide, which makes the blood pressure crash. The treatment? Epinephrine, to reverse that reaction and tighten those vessels back up.
See? Totally different problems, totally different solutions.
So, at the end of the day, why does this matter so much? It's simple. In a real emergency, giving the wrong drug for the wrong type of shock isn't just a mistake. It could be the last mistake. Getting it right and getting it right fast is everything.
So let's boil it all down to a super simple checklist. Here's what you need to ask. Is the person having a known heart problem? It's probably cardiogenic. Are they having a known severe allergic reaction? Think anaphylactic. Is the fix designed to help the heart pump? Cardiogenic. Is it designed to stop an allergic reaction? Anaphylactic. Those questions get you to the right answer.
So it really all comes down to this, doesn't it? In that high-stakes, life-on-the-line moment, knowing the difference between a failing pump and an allergic overreaction isn't just some trivia question. It's the piece of knowledge that can literally